All right, today we're talking about a real medical smart bomb, clarithromycin. You've probably heard of it, maybe you've even taken it, but do you really know how it works, or just how powerful and potentially dangerous it can be? We're going to break it all down. I mean, think about it for a second. How can a single pill be the answer for so many different things? A nasty lung infection, a sinus infection, even stomach ulcers. It seems kind of crazy, right? Well, that's exactly what we're here to figure out. We're going to get the full mission briefing on this drug and see precisely how it hits its targets.
Okay, so here's the plan. We'll start with its special mission, then get into how it literally sabotages the bacterial factory. We'll look at its very specific hit list, uncover a secret helper that boosts its power, and then, and this is super important, we'll get to the critical collision warning. Finally, we'll wrap up by looking at why this antibiotic is such a powerful but calculated risk.
All right, let's jump right in. So what is clarithromycin? You might know it by its brand name Biaxin. It belongs to this really interesting class of antibiotics called macrolides. And all you really need to know about them is that they're these big molecules that are fantastic at getting inside our cells. But clarithromycin isn't just another member of the club. No, it was specially engineered to be better. See, it was created to be a major upgrade over an older drug called erythromycin. The mission was pretty clear. Make something that could kill more bugs, that your body could actually absorb more easily, and, a big one for anyone who's ever taken antibiotics, wasn't so rough on your stomach. It's a perfect example of scientists constantly tinkering and improving the tools we have.
Okay, now for the cool part. How does this thing actually work? Well, the best way to think about it is to imagine clarithromycin as a tiny secret agent sent on a mission to sabotage an enemy factory from the inside. And the way it does this is just incredibly precise. First, our little agent zeroes in on the bacteria's ribosome. Now, this is its protein-making factory. And here's the key. Their ribosomes are different from ours, so our own cells are safe. Next, it latches onto that machinery and just jams it up. It's like throwing a wrench into the gears of an assembly line. This completely shuts down protein production. And without those proteins, the bacteria can't build anything, they can't grow, they can't reproduce. The invasion is literally stopped in its tracks.
So here is a really important distinction. Clarithromycin is what we call bacteriostatic. That's a fancy word, but it just means it doesn't usually kill the bacteria outright. Instead, it just freezes them. It stops them from growing and multiplying. This is brilliant because it gives your own immune system the opening it needs to swoop in and clean up the mess. It's less of a sledgehammer and more of a strategic move to disable the enemy.
So who's on this antibiotics hit list? Well, it's what we call broad spectrum, meaning it works on a lot of different things. But where it really shines is in taking out these very specific, tricky targets, the kind that a common antibiotic like penicillin can't even touch.
Its range is pretty impressive. It'll handle common stuff, like strep, sure. But its major claim to fame? How good it is against these so-called atypical pathogens. These are the sneaky bacteria that cause a lot of respiratory infections. On top of that, it's a go-to for fighting the bacteria that causes ulcers and even some really serious infections that people with weakened immune systems can get.
Here's a perfect example, walking pneumonia. You've heard of that, right? Well, it's often caused by one of these atypical bacteria. And this little bug doesn't have a cell wall, which is what penicillin attacks. So penicillin is totally useless here. But clarithromycin doesn't care about the wall. It goes inside the cell to shut down the factory. That's why it's such a key weapon for doctors in this case. And then there's its other greatest hit, H. pylori. You know, for decades, everyone thought stomach ulcers were just from stress. Turns out, it's actually this nasty little bacteria. And clarithromycin, it's a cornerstone of the therapy that can completely wipe it out. A total game changer.
Okay, so the drug is already pretty impressive, right? But get this, the story gets even cooler after you swallow the pill. Your own body gets in on the action and creates a secret sidekick that makes the drug even more powerful.
This little sidekick is called an active metabolite. And the idea is really simple. When your liver starts to process the drug, it transforms it into a new substance that is also a bacteria fighter. It's like your body is giving you a 2-for-1 punch against the infection. How cool is that?
The sidekick's official name is 14-hydroxyclarithromycin. A bit of a mouthful, I know. But this new molecule works right alongside the original drug. And sometimes, this dynamic duo is even more powerful than clarithromycin was on its own, especially against the kinds of bacteria that give you nasty sinus or ear infections.
Okay, now we need to get serious for a minute, because all this power, it comes with some major risks. The very thing that makes this drug so special
is also what makes it potentially dangerous if you're taking other medications. And you really, really need to understand this part.
To get why, we have to talk about something called the CYP3A4 enzyme. Just think of it as the main traffic controller for your liver. It's a super important enzyme whose job is to break down and clear out tons of common medications from your body. Everything from cholesterol drugs to anxiety meds.
And here's the problem. Clarithromycin basically walks up to that traffic controller and puts it in a headlock. It's a potent inhibitor of CYP3A4. It blocks the enzyme, and that causes a massive traffic jam in your liver. All the other drugs that need that enzyme to get cleared out are now stuck in gridlock. Their levels in your body can skyrocket to dangerous, even fatal levels.
And we are not talking about a small problem here. Look at this list. You take it with certain statins for cholesterol, you could get severe muscle breakdown. Mix it with some other common drugs, you could trigger a fatal heart arrhythmia. This is exactly why it is absolutely critical that your doctor and pharmacist know every single thing you are taking, pills, supplements, everything, before you ever take a single dose of clarithromycin.
In fact, these risks are so real that the FDA slapped its most serious warning on it, what's called a black box warning. It says, point blank, that people with coronary artery disease should not take this drug. Why? Because studies showed it could increase the long-term risk of serious heart problems and even death. This is not a drug you mess around with.
So let's pull all this back together. What we have here is a tale of two extremes. On one hand, an incredibly powerful, uniquely effective weapon against tough infections, and on the other, some very real, very serious risks. So what are the big takeaways? 1, it's a powerhouse, broad-spectrum antibiotic. 2, it's a specialist, amazing against those atypical bugs and H. pylori. 3, it has that unique helper metabolite that boosts its power. But then you have the other side. 4, it powerfully blocks that CYP3A4 enzyme, which can cause a cascade of dangerous drug interactions. And 5, it has that serious FDA warning for anyone with heart disease. The bottom line, you have to be incredibly careful with this one.
And really, that's the crucial point. Clarithromycin is an amazing tool. It has absolutely saved lives. But it is not a simple prescription. Its power demands respect. And using it safely comes down to one thing: having a completely honest and thorough conversation with your doctor. They need to know everything.
And that kind of leaves us with a bigger question to chew on. We're all worried about antibiotic resistance. And the story of clarithromycin, with its incredible precision, but also its very specific dangers, it makes you think. For the future, what do we need more? Just stronger, brute force antibiotics? Or smarter, more targeted ones like this? Something to think about. Thanks for tuning in.